On this episode, we'll talk about if you can get surgery if you have a heart condition. We'll also be talking about the use of nicotine patches in preparation for surgery, and we'll talk about the need of stopping Ozempic to get weight loss surgery. Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to episode 231 of the Ask Dr. A show. And if you're new to the show, let me explain of how the dynamics here of how it works. You are able to send me your questions regarding weight loss surgery, regarding gastric sleeve, or anything that you might like to ask me, and you're welcome to do so. And there's one way to do this is using the hashtag AskDrA throughout social media. Don't forget to use the hashtag, otherwise we can't get to those questions, and we'll be add them here to the list, and I'll be more than happy to be here to answer them for you. Also, if you're interested in weight loss surgery, gastric sleeve content, be sure to hit that subscribe button so that way we can hang out again. So let's get into the show. All right, so the first question is, Doctor, I would really like to know if I can get weight loss surgery, but I have a heart condition. And in this specific question, this patient had a previous aortic valve replacement. But if you have a mitral valve, if you have any other specific cardiac condition, can you get weight loss surgery? And the answer is yes, but we need clearance from your cardiologist. All right, so your cardiologist that knows your history, that knows your previous heart conditions, that knows how you've been treated and your current condition, they need to write off a letter, a clearance saying he's or her, she's good for weight loss surgery. There's no extra risk because of that condition. And yes, we do this very, very frequently, but we work together with your doctor back home and in conjunction to proceed for weight loss surgery. The answer is yes. If you can get clearance by your doctor, it's not an issue. Second question is it okay or is it good to use nicotine patches, gum, etc. to avoid smoking in preparation for surgery? And the answer is makes no difference. Makes no difference if you're smoking, makes no difference if you're using a nicotine patch. So studies have shown that using nicotine in any other form, patches, gum, etc., pretty much has the same risk of the people who are smoking. So what is the best advice? Abstinence. Stop the smoking, no more nicotine for your body, and that will give you the best benefit. How much before should I stop smoking? At least 4 weeks before surgery, ideally 6, and that will give you the best outcome, lowering your risk of any complication related to the smoking. And the third question is, do I need to stop injecting myself with Ozempic if I'm thinking about weight loss surgery? And the answer is yes, at least 1 week before surgery. And let me tell you why. This is more an anesthesia point of view, not so much the surgery. Surgery is going to be crafted the same way with Ozempic or without Ozempic. But the anesthesia is different because as we normally tell patients and we fast patients so they can be in an empty stomach for the time of surgery, so if they're throwing up or there's a case of vomiting, you have an empty stomach. That's because of the anesthesia. You're sedated. We don't want we want you with an empty stomach. Just being on the safe side. But when you're with Ozempic, that medication, those GLP-1 agonists, those medications will delay gastric emptying, and that timing is different. So we suggest you stop even a week before surgery, so that way your body by the time of surgery does not have that effect and your stomach is emptying correctly and the amount of time of hours of fasting we give you and we suggest to you, so by the time you have surgery, your stomach is empty. Your stomach is empty, and you don't have that effect of the Ozempic delaying that gastric emptying and have stuff in your stomach. I hope that makes sense. So yes, we do recommend you stop Ozempic or any of those GLP-1 agonists before surgery. All right, so there you have it. That's it for episode 231 of the Ask Dr. A show. Thanks so much for joining us. Don't forget to send me your questions using the hashtag AskDrA. Did you like the episode? Really good questions, by the way. Very specific questions. I like them. If you did, if you can leave me one of these, I greatly appreciate it. It's of great support toward the channel. And don't forget to subscribe. That way we can hang out again. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.